gaafilee siyoosii walma qola torbaan mata ammaan tana fatana jiru tan gaaffiin akkuma jirti wallahi 100% ni geesti. Yoo xiqqaate gaafiin 40-50 as keessaa ni dhufti haareen takka takkaatti dabalama. Mee takka faamaa laas deebisaan asirreertu taasirrees jirti tasirriin taanes jirti. Saniifuu mee takka faamaa laa taatu which malignant tomorrow come to in HIV positive patient kayu bida. Lamaffaan what is the third step of nursing process kayu planning gida chusiidha. Ayasataba select the correct between of the airway respiratory system or respiratory duct to descending order khati khamin matakafa mouse nose janna sambodo pharynx larynx trachea broncho alveolia yannachu kanafu ada Satian to direct a route of pediatric visit to months old patient khayona with the need to which of the following vaccine yechu tema matala haye mal taun rotavirus yechu. The most common cause of gastric cancer kayumo H. pylori infection in the air hayuanachu. The disease is become usually with separate and even global known as malhono a pandemic idatachu ara hayuana. What is the other name of infection disease kayumo communicable disease idachu. RH negative maternal blood including maltahoni. The mother does not have a specific mark on her red blood cell are hayuhanachu debisanisa. Khatian what can reduce patient anesthetic to post-surgical pain khato mo preoperative teaching idachu. Preoperative teaching in barra jirachu. What is your first priority intervention of client shows the sign of anaphylaxis with intravenous antibiotic khate en the antibiotic takechu na makanete han wanta lake shogo gocho intravenous ilanju chukza khanete shono mali biza sam dirqa mal goru gabda stop the intravenous flow de kasan stop goru gabda chu gafin tuntu mol sani dibe when can reduce patient anesthetic of social kajomo yanne jira bida preoperative teaching greneni. How many bone are in the adult skeletal system khayu ibala ma fi jaha. Which one of the following is the first step of approaching the child persisting with the seizure? Manage the patient according to the ABC approach. Takafana wantagore ABC approach ila lavetu. Which is the intrinsic risk factor of the place in the client risk of pressure ulcer katia khami impaired tissue perfusion to sira khajurkhan. Which of the following right position of patient of inamadaf mal gonafi leave the lateral position birra khajurkhanachu. Which is the following about 2 years old child vital sign of respiratory rates sodoma birzi per minute yote pulsing sa mo dibba fi khudan beat per minute yote blood pressure insa sandam shenjelo sadite belama yote malta hada khunama edata the blood pressure is little of below pressure insa garu gabhe but garu other falta signing kan mo normal yechu tanafu erra hajuru hanatachu. What is the step can prevent transmitting the HIV virus from mother to baby after birth khayuhuna mo admit prophylaxis intravenous treatment to the newborn birra khayuhuna. Among the following one is about vital event registration of local continuous khayuamo domestic birth data registry dahon sirra khayuhuna isai chuhan wasa saguna. What is the right of order of apply for FSH or more sort set chain standard in the CKR Hayurhanachu? Which of the following life turning actual complication of the diabetes mellitus kayuamo hypoglycemia? Which of the following include additional newborn carry hayuhoni wala masra walkabe breastfeeding if I carry hesa tanafu breastfeeding irachu. which one of the following international state standard ethical practice to nursing through the world hayona mo code of ethics which is the name of the virus of covid covid b masalmus covid-2 hayona b which one of the following general danger sign of children hate era hajiru kon diludum disorder kayo mo heda constitution what where does fertilization occur to female reproductive tract kayo mo ampulada patient need 2 units of the peak red blood cell and the patient type of the cross match HIV separated siru hayennon kuni share of needed dachu which era hajiru which of the following true about body temperature of measurement hayennon rectal or aquar olar and axillary hajuhana adachu 30 years old male client is just be admit you for the onset of distribution of behavior in due to and now care use prepared of the height European Yuchusati Ushodumulatu Alamat Kwasha milligram Yote and new now the patient distribution of the higher flow of the inspection 5 milligram ml how much medication of the patient hunamo 0.5 or 1/2 which of the following is the vector of infection khate and influenza flaw hajuhana ada hajuhana which is the classification include alcohol safety or drug risk factor khate amo behaviorally dahun. A nurse is a monthly 25 years male patient recovery blood transfusion on assessment in the nurse found the respiratory rate 24 per minute blood pressure in a more sagaltama jala jahtama yote which one of the following priority of the actual nursing nursing you choose it mal godu ko ba khajannun immediate follow immediate stop the transfusion godu ko ba immediate guzmati stop to transfusion go ba open bed is open bed immediate stop transfusion open bed is made when is the patient open bed khajannun in cherry da male discharge chun gutumangutu bedemul in bedi chun mo bedi rigireni no san occupied bedi nami sanifu in cherry da cerebrarati da versite sanafu chun open bedi da chu what is the best teaching method of the healthy worker in the community khayannu namo domestic a group of mother dir hajiru hanachu nurse use nursing process of the method khayannu namo b planning organizing delivery patient care which of the following risk factor most like able to correctively on lifestyle choice gabin duna kan ma dufte directly wata karan rakan tanafu lifestyle choice dachu birah yurona which of 5s pass focus the clean or dry remove which on to mali shiny da hon dirra pain is released surgical insertion evidence by patient team vibration kayura mohon actual nursing diagnosis birra hajuhanachu complete or incomplete theory in the ligament surrounding of joint hayannun kunamo ega ligament jamalta ispereni dirra hajuhanachu with the primary purpose of standard nursing practice hayannun be to ensure knowledge of the safe comprehensive nursing care hajuhanachu which route of converted for temperature of measurement hayannun kunamo tempanic dachu ndongori na wana hane du namni dongori jira tanafu tempanic yechu which is type of legal consent indirectly given by the client by the very natural of the voluntary actual care hospitalizing kainun kunamo and implied consent sirra hajurhanatu yebisachu excessive or unless worry about everything known as normally generalized anesthetic kayanun birra hajurhanachu general anesthetic kayanun birra hajurhan the hormone productive mother of milk kayanun haadha hataa jechuudha. Prolactin jennu kana. Which of the following is the first step of planning healthy program kan jennuun ammoo undertaking installation of analyze kan jennuun kana jechuudha. How many How many tablets should be administered daily using the below information? Doctor body weight is at 40 kg to develop milligram of medication. Once of the medication 1 tab is equals to yatagayo dibba milligram yot yatanafu dibba wan yatanafu 2 tab sirra hajir honacho. Which type of data collection of technique is approach for response when cannot read to the right nama dubisu interview dahon. The patient asking user explain how to intravenous pressure measurement help detect glycemia. You state the IOP intravenous pressure measurement with the instrument. Tanafu dubisaa nisa aadha jechuudha arra jiru kana. Woman is infected human papilloma virus like to be risk of kayanun kunamok cervical cancer yennan jechuudha. Contraceptive method severe dual purpose kayanun ammoo condom da bida condom. The patient of the actual tuberculosis taking in ibitomatol as a nursing you make priority as a patient hono Virginia hanata jechuudha. Bida jira Virginia the principle of the fairness kajamu justicida si jechuudha. What does it mean to be removed when to own the chronic illness hayannun enyu? The disease is present but garu symptoms are not expired hayannun dirra hajiru hanachu. Which organ primary affected tuberculosis kayannun ammo langada. Which of the following continuous systematic critical review project program kayannun ammo monitoring gida bida. Which of the following ethical principle of promotion of independent of choice of client malet B autonomy. The rule of the nurse which of critical prevention of care hayannun kunammo harra hajiru hanachu. What blood type known as universal donor hayannun oda bida bida hajiru hana type oda. Bukalmika should kayannun ammo between the client check and the gum kayannun kana. Which of the following case of need palliative care kayannun ammo si terminal inpatient ida. Which of the following test management involve flexion in the neck? Which of the bending the neck can alternative pain in the tension to the spinal cord kayannun ammo bulini iskainida arra hajur vecho. One of the following desires the holistic concept of the health hayannun ammo emphasis connect mind body and the spirit DH dar hajiru hana. Which is the position you place your patient when they are demonstrating the sign and symptom of hypovolemic shock position hayo yannen di hayannu trending position kayannu kana di hain jechuudha. Hainama hypovolemic shock position akkam kayyuu san diidha jechuudha. With the administrated eye drop nurse should admit the drop into which location kayannun B the conjunctiva saca. The appropriate bed from the patient with the pulse rating above beat minute yote respirator of mission bar minute inside yote humala famafia con cardial bedid. Which of the following Afghan scoring substitution of the and now born persist with the heart rating of sedatum yechu 80 minute yote kana mal jennani huwata kan gab Afghan scoring wani of yannan sirra hajiru. The three most common symptoms of asthma hayannun ammo cough, dyspnea and wheezing arra hajiru hanachu. The patient taking ionized DHO ionized khate the monitoring of the deficiency khate ionized deficient DHO vitamin B6 nanaju and the manzi all the child in the means of belong emergency room khasati in instability allergical dry skin is increased perfusion today. What is the additional findings the nurse world? Yes, kana jechuun dehydration ni dha jechuudha jiru, which is the oral disorder appropriate which of the petich on the oral mucosa that can bleed due to scalp hayannu namo candidiasis kana si dirra jiru kana isa dirra jiru kana akka jennaan hayyee candidiasis jennemi infanticide of cardiac arrest confirms the absent hayannu namo cardiac arrest femoral palsy femoral palsy which type of fracture common young children hayannu namo Greek bida. What is the purpose of weakening of the pathogen hayannu namo attention see a pregnant woman who has healthy 5 years old child no history abortion and the site birth is the classified under genen kanafu gravida to parawani dirra hajiru hana, which is the classification include alcohol safety gafii tanware option DB behaviorally tanaf DB sensory behaviorally BH. What your first preoperative interview of client showing the sign of anaphylaxis with the intervention of antibiotic yenun stop to intravenous flow with honey we universal donor kayenin type dirra hajiru odiyenne one of the safety device among of the following hayenu namo cotton ring ida one of the following on describe the holistic concept of the health hayenu namo on is kind of an impressive the connect mind the body and the spirit dirra hajiru kana which one is the waterborne disease hayenu namo typhoid ida. The first step of management of process hayenu enyu planning ida. What is the other name of infection disease hayenu namo communicable disease ida. Which of the following solution recommended of the oral cancer hayenu kanamo enyu 2% hydrogen peroxide C khana tamale dinto. Which of the following method of natural family planning of method hayenu namo calendar hon. Which of the following indicate special prenatal care hayenu namo vaginal discharge ida. Which of the following will organization akati khanetti bir hayenu holistic state of well-being haju bir hajiru hana. Which of the following life treating actual completion of diabetes mellitus kajuhun hypoglycemia da. Shorty of breathing flightus position kayenu namo orthopnea C. How much dose vitamin K given newborn hejole chu galkaba dalatif vitamin K angam taka D 1 mg vitamin K. A nurse was monitoring 5 years old male patient receiving blood transfusion. On assessment, the nurse found the respiratory rate is 24 per minute and the blood pressure is 70 milligram. Which of the following priority actual of the nurse gafin immediately stop to the transfusion gotachu a 74 years old female HIV patient person of the persistent painful artery artery involving genital area internal gluteal cleft in the 2 years duration she's a react with the initial lesion with the vein which of the initial ruptured. What is the most likely of the diagnosis sanafu herpes simplex jani veka bishani godi rara domal herpes simplex ida. Chronic hepatitis B virus infection persistent hepatitis B agent significant. Which of the following is malta hepatitis B ongoing viral replication is sirra hayur khana ta chu dibisan. Which of the following vaccine recommend given to BCG and PCV or PV0 What combination should be high and worse immediately post-operative period of time killing who is the just thyroco synthesize tanahu debisan pneumothorax pneumothorax. The maximum time of hand hygiene akka fadhillee guddatu 20 up to 30 second malee 1 minute in top, which is the intravenous would use most like to for the killiant complication of abdominal distension and the flightus. Kayennu mo cleansing nama ada malee flightus miti, which is the most close in the ethics. Kayennu mo killiant right in the which of the following assistant tool used to determine the patient with the level of unconsciousness. Kayennu namo C class scale C rahajiru. Tuberculosis is a continuous bacterial infection caused by microbacterium tuberculosis. Kayennu B rahajiru. Kana which of the following schizotypal personality disorder would be observed with kayennu namo body legionate B rahajiru. Kana what is the right of ordering? Kana refu choice dubanne jirra short seti D rahajiru. Kana setti which of the following palliative care kayennu namo improve quality of life is here. Kana kuma choli jenne gafii sanuma grave datu parawani kayennu kana cho which is a malignant tumor come HIV positive patient kayennu chumoli ba. What is the last step of health information system? Gafii nura kuma dufti jiramta kan qabdu diminution in the kana taati. Which one is the most common cause of iron deficiency anemia? Kayennu namo lack of iron, chronic blood loss bida ama lack of iron deficiency je iodine deficiency len gafii sosi tana kaisani jira as kaisalle jiraachuu baatu gafii ni jira dhuftee jirti wadda. Among of the following one of performed independent of nursing malnutrition metastatic godata inamada. The first is should be immediately after killian accident. Kayennu namo assist the killian tida. Which of the following risk factor associated with improve the gliding windy hailing? Kanafu a lack of zinc the which of the following immediately reportable disease? Kayennu namo measles bida. The scribe nurse is circulation nurse to give their contact time before surgical procedure, meaning that during the surgical procedure such as additional package of the opening additional disease sterilized file. Kayennu namo first contact. Drops have been ordered 10 months old child. How you feel the image of the following mother of two people babies of the air? Kayennu namo air rahajiru. Kana down in the back kayennu kana babies baby is should double to birth weight. Kayennu kana mo C rahajiru 5 up to 6 months ida. Antibiotics are effective agent. Kayennu namo D cholera. Application of information kayennu namo C knowledge ida. Which of 5 of the following is kana mo akore shine C rahajiru. Kana in the adult who is receiving heparin nursing cannot give in the mouth. The nursing responsive heparin gives the parenteral because yanan C destroyed with the gastric secretion. C rahajiru. The stage of malignant disease recovery using the symbolic nature with to scale used to yanan order C. Which of the following typical sign and symptom of pneumonia? Kana typical of pneumonia hayu A productive blood spontaneity. HIV positive patient is just DID kayennu namo postpartum care and C rahajiru. Kana kawshar core kayennu namo protein ida bida. Which can cause the justice which is a complication should be during the immediately post-operative period. Kayennu namo post-operative kayennu namo pneumothorax ida. Which of the following device surgical unit are to satisfy surgical arrest? Kayennu namo semi-anesthetic area yanani chukota kayatani chu the demilam years old male patient since abdominal pain day to duration, which was the initial around the pneumoclear regional later of shifting right lateral quadrant during the physical examination. The patient in lower quadrant sign of positive patient is none B ennaan jechuun deebisaan isaa which is the pulse means palpate of the domestic cardiac function of infant jennuun femoralidha. Which of the following step of last step used during the physical examination of abdominal jennuun ammoo deep palpation. C. Which of the following incidental newborn caring breastfeeding dha. Type of data collection of the approach of the connected writing and interview dha. The patient of need 2 unit of the blood cell jennuun akkuma reefu HIV kan separate jedhu jennuun ammoo share needle dhagenne. Which the method to prevent separate high infection waste bakka jennu lala high infection waste tanan no infection waste non infection waste tanafu sorting dha. Which one is the major cause of small intestine obstruction kan jennu ammoo and the CVD tanatati. Which of the following blooding focus antenatal care kan jennu ammoo fewed comprehensive C tana. Which of the following staff member who has a quality sense another staff seen of the neighbor pressed in the microorganism and develop quality to microorganism jechuudha. Where most like nama tokkorraa gizaanii fasitti achifate qotaachaa nutti deemee haa gizaanii fasitti fate maal ta'a jechuudha. Namni kun dropletidhaan maal godha microorganismii dabraman dabra. The sign of the most important is the control separate infection by through the one hand washing dha. Which of the following comfortable poison of the COPD jennuun ammoo the high followers jennuun kana. Which of the following including the most severe jennuun epidemic outbreak endemic arra jiru kana. The maximum of score jennuun ammoo 3 hanga 15tti arra jiru kana. How much liter of serum incidental of adult client who has accident of poison kana ammoo ml 500 hanga mallattoo hundaatu. B. One is on management of perineal and external according to rising gubensi to maal bakka buuti jetti aada president human infected of human papilloma like of the at risk jennu cervical cancer jenneen bida. Which of the following assist of physician khaynni lumpar puncture jennuun si kana. Which of the following risky demonstrate virgin jennuun kana dira jiru kana. Priority straight compul without the health care resource kind of community jennuun dira jiru kana. Which one of the following is the airway management maneuver appropriate of the cow is subject of spinal trauma jennuun kun ammoo Gauter's maneuver arra jiru kana. Due to the broad variety patient information of share access information of response jennuun ammoo confidentiality jennuun kana aada. Which organ primary effect of tuberculosis jennu lungidha. Which vaccine give by subcutaneous routine measles. Which is the infect risk factor of place client risk of pressure ulcer jennuun dida. Which the mentioned health education of the made of stool child jenneen domestic dha. Softening and taking cervix through labor jennuun ammoo effective B dha. Which of the following sign and symptom common sun patient right side of heart failure jennuun ammoo jugular vein distension dha. B. Which of the following type of mudakhasa describe of the periodic quality of jennuun ammoo defective ada. Human immunodeficiency virus main affect type of client human body jennuun ammoo dira jiru kana CD4 positive jennuun. Remove of fluid periodic cavities through the spine surgical incision under sterile condition known as honi dira jiru kana persistence ta. Which classification include alcohol jennuun kun ammoo behavioral jenne. Which you first periodic kunis akkuma reefu jenne stop intravenous dha. Universal dosing kun ammoo type O dira. The rule of nurse serial preventive fragmentation of care jennuun ammoo C. This is that because unusual with separate even global jennuun kun akkuma pandemic dida. Gafin the principle of fairness in the integrity justice dha. Which is the most common immediately care of major trauma jennuun major trauma kajenun latin injury brain heart major blood virginia hanachi which of the following cause of needed palliative care namo bida skeletal system haju how many bone of there is adult of skeletal system bala mafija which of cap greatest risk to domestic vision kajenun sida serati prevent district kobul kajuhanu what type of immunity across the personal of the milice kajuhanu active natural immunity kajuhanu bida appropriate of connect read and writing hajun nok mare debite be interview ganne buccal mucosan buccal medication in akomajane between kidante jekan daga sida only type of insulin stable of the intravenous admit kata n regularly of b which kind of sample can be used to isolate polio virus in c study delirium disorder kajenun sida appropriate bed of patient pulse rate hanamo cardial bed yenen 0.5 yenen sida katian ke the following essential new work breastfeeding yenen gumega debite which of the what intravenous of the best relief conception of during pregnancy kajenun namo increase of concentration of fiber diet R kajenun how many dose vitamin K kajenun C 1 milligram which of the following procedure does not assist physician kate enyu lumbar puncture yenneni which of the following life threatening actual complication of diabetes mellitus kajenun hypoglycemia da baby of the belly shanyanga jahadira hajiro which of the following body temperature of emergency kajenun rectal or tira jira hunasitti rectal more actual anesthesia kajenun which of the following blood group P kajenun konamo T O positive kana which of the following in control pressure of infant preventing hepatitis B kajenun blood in the body fluid persistence kajenun kana bida which of the following characterized focus the antenatal care kajenun few comprehensive vida what is the pace nursing process data collect of validate kajenun assistant phase ida eda which of the following is major cause of under 5 mortality of Ethiopia kajenun pneumonia C which of the following adult accident poisoning hona koref debite emeli dibashan janneni asiol jiranan to dendanga homati most common cause of iron deficiency janne chronic blood loss bida most common cause of gastric H. pylori infection tanware hosen debu jira gafii from independent nursing inamada hydropia kata tidante busan conjunctiva saxida tunistan mare dufte cleansing inamada ti ada kashar kosin tunistan madoye dufte kashar kosin protein ya fluid volume read vomiting evidence of disease tunistan actual nursing diagnosis microbial all the patient to persist kayenisa honomal taha receipt a meta which type of legal consent indirectly given to kill and voluntary actual hospitalization kayenun asarati b implicit consent khanata which of the following hepatitis transmission fecal oral route dan katabru hepatitis A da D radiation D da hepatitis A kayenun kana 5 years old mild of through the pneumonia cough a small amount clear sputum on temperature severe chest has the breathing 45 breathing minute patient no hospitalization gennan tanafu di community acute pneumonia sila mystery hospital gabati akasento tanafu hospital wan kapne di community acute pneumonia certificate of nursing process kayennu namo planning gidenne iron injection adult iron injection isara jirra haju track ami glotal kayennu r kayennu what is the cause agent typhoid na tuberculosis disease kayennu namo bacteria t staph membrane sinus on droplet d data open bed kayennu in cherry kayennu kana bida scribe nursing kun kare for first contact ya jenneen sanii miti scribe nursing circulation kayo kan jechu which of the following natural family planning methodin natural family planning ennan calendar kun WHO akkamiti ka fayyaa kayo holistic state jira kun khattaanullee which of the following assist total kayo refulalle gilako aada jira which of the following effect spational mouse carry khaynun kun ammo for impatient question sirra hayro kana which of the following most common of covid kayennun kun ammo droplet ida honilin wani ni transmit afuranis antanya chu droplet ko anta to hanin during the active pass of labor cervix delivery kayennun sadid yang afur yang ga 10 cm di primary immunity occurs after natural infection kayennun ammo measles immunity occurs after natural infection which of the following indication give efficient prenatal care kayennun vaginal discharge jenneen khattan of the following most appropriate duration to next kayennun kunamo full relation cervix of delivery fetus kayennun kanachu a manage HIV positive kun akkasuma dhufe khattan usni jira b da deficiency da preparate chingi kana stage which is the stage of indication show client expressing the general malaise kayennun kunamo a periodoma stage da client with hemorrhage temperature 30 fi jayo te pulse sa ribba fi 40 per minute yo te respiratory sa 27 yo te bp sa 70 yo te nurse should be question of the physical examination order physical examination orderi wani godamu qaba malid tanafu monetary urine output inna every hour yechu add kafin record of the first step of manage your process